what we're doing.
But we can't today.
Gotcha.
I know.
Gotcha.
Hi, everyone, and welcome to our Facebook discussion today on infertility. I'm joined by Dr. Daniel Groh from the Center for
Nice to be here. Thank you.
Thank you for joining us. So, first things first, you guys have a new center.
We do. You know, we have the biggest IVF program in Connecticut, and we're setting up a branch of that in Branford, Connecticut, right on the shoreline.
Now, how many offices do you guys have around the state?
The three main ones are in Farmington, in Hartford, and then this new one in Branford.
Why is that? Why do you think that's important to be in so many different areas of?
Well, we have a lot of patients coming to see us from the Connecticut shoreline, and one reason we want to make it more convenient for them, and we want to just give them an opportunity to come see us in an easy way.
Now, infertility sometimes is a taboo topic. People don't really like to discuss it. Why do you think that is?
Well, you know, there's few things more personal than trying to get pregnant. And, you know, and it's you know, when a couple can't get pregnant, they often struggle with why. They start wondering why. Is it something I'm doing? Is it something I'm eating? Is there something that's wrong with me? And it's a personal enough subject that you can't talk about it with sometimes your family members, sometimes your friends, and so we like to be there to say, hey, we'll do the thorough evaluation, we'll help you through this, we'll help get to the bottom of this, and let us worry about it, because we're pretty good at it.
Do you see some issues that are more common than others when couples come in?
Yes, so half of all fertility is due to male factors, and the men aren't usually the ones worrying about it sometimes, and so, you know, we can do a test for that. There's many treatments for male factor or the many female factors that are involved.
And I only know this because I've done so many stories with you guys in the past. You really take a broad approach to fertility. You have a lot of different doctors and holistic methods that you guys use. It's not just testing and blood work and egg retrieval. Can you talk a little bit about that and the different methods that you guys use?
So to the first part of your question, we often want to take care of the whole person first, make sure they're healthy, eating well, their meds are tuned, they're exercising, they're as fit as they can be to be in a healthy place to start a family. But then we have lots of tools and tricks. We have lots of tests we can do to figure out what the problem is. And, you know, and we do, the two main therapies we do are intrauterine insemination, help get more sperm delivered so the egg and sperm can meet and do their thing, or in vitro fertilization. And
now, for people that don't know what the difference is between those, can you explain it a little bit?
Yeah, so with intrauterine insemination, we often will use a oral medicine to help stimulate 2 eggs to be produced. And then on ovulation day, there's some testing to determine that, maybe with an ovulation kit. And, we do an insemination. Husband gives sperm in the morning, and we deliver that sperm to the uterus at midday on ovulation day, and the pregnancy rates are dramatically increased over trying on your own.
Nothing really surgical about that.
There's nothing surgical, and it's really pretty simple. A fertility medicine, some urine testing, and insemination.
And then the IVF?
The IVF is more complicated, but it's also probably 3 or 4 times more successful. We help with injections, the ovaries to make 10 or 15 eggs. Those eggs are retrieved about 2 weeks after that cycle starts, and eggs are mixed with sperm. Eggs fertilize, embryos grow, and we typically put 1 embryo back to the uterus. And the live birth rate from doing that for women under 35 is about 50 to 60% per attempt, putting 1 embryo back, and so most of those pregnancies are singletons.
So the days of implanting several embryos, not so much anymore.
Exactly.
Are there cases where you would put?
There are cases in women who are older, or in some special situations we put back more than 1, but we like to put back 1. You know, the days are, you know, when I would get a phone call from the director of our NICU, the neonatal intensive care unit, Dan, how many triplets are you going to send us this year? Those days are over. Now we like to say none. Almost all of our pregnancies are singletons.
Wow.
It's exciting.
If a couple is having trouble conceiving, how long should they wait before they come and see you?
So it really depends on a patient's age. For patients who are young, they'll often wait a year before trying, and I think that's a good thing, unless they know they have a problem, unless they know they're not ovulating, or they know they have endometriosis, or they know if they have fibroids, or some other problem that they know about, then we'd love to see them sooner than that. For patients over 35, usually 6 months of trying, because there's a fertility declines pretty quickly between the ages of 35 and 40, and we'd like to help them as best we can to get ahead of the curve.
And now the center is not just for people having trouble conceiving. You see a lot of young women wanting to freeze their eggs as well.
We do, and so this is kind of a new thing. Egg freezing technology is pretty new, and it's pretty successful. And so we have a lot of young professionals. We have, medical residents and surgical residents and dentists and lawyers and women who, are not ready to have a family yet, but they're in their early 30s and say, geez, I'm afraid that by the time I'm ready, my egg quality will decline, my fertility will decline. And so they come in, they freeze 10 or 20 eggs, and they're essentially, almost guaranteeing a baby for the future when they're ready.
And in the past, I found this interesting when I was at the center the last time. Before, the chance of conception was higher in a fertilized egg, but that's not so much the case anymore.
That's really interesting. It's really interesting. The answer is a little bit complicated, but eggs freeze really well, so freezing and thawing them doesn't seem to hurt them. Freezing and thawing embryos doesn't seem to hurt them, and in fact, when we put a fresh embryo back, it's fresh because the ovaries have been stimulated making 10 or 20 eggs, and so the estrogen levels are 10 or 20 times higher than they are naturally. So putting a good embryo into a uterus stimulated with lots of hormones maybe is not the best thing. Maybe it's better to have more physiologic levels of estrogen and progesterone to put that frozen thawed embryo back, and they do great. The pregnancy rates are fabulous.
Now, there is testing that if a woman's not sure, they don't know what their fertility level is, they can come and see you and you can do a pretty simple test, right?
We can do, and I think the test you're talking about is AMH, and that's a test to tell, in short, how many eggs are left in my ovaries, or how fertile my ovaries are. AMH levels, when they're really low, it predicts earlier menopause, and AMH levels that are normal predicts more normal ovarian fertility. So it's a quick, easy test that gives you some sense.
A little peace of mind.
Yeah, yeah.
Now, if a woman is thinking of freezing her eggs, what is, the latest that she should come in age-wise?
Wow. So there's some decline, in after the age of 35. So we love to see patients before 35 because we know we're going to let them store their best eggs. Pregnancy rates for egg freezing after the age of 40, there's lower response. And so we really love to see patients certainly before the age of 40. After that, it's on a one-by-one basis.
Now, when you do retrieve the eggs for freezing, or when you thaw them, can you test them to see what their quality is? Or do you kind of have to wait until?
Yeah, so that's hard to do. Yeah, we can test embryos, but it's harder to test eggs. Eggs, kind of the more the better. Embryos, and you maybe are referencing a technology where embryos now we can, on day 5, we have 100-cell embryos, and we can take a couple cells off an edge of that embryo and do testing to see if that embryo has the right number of chromosomes. If it doesn't, chances are, if it has abnormal chromosomes, chances are it's not going to make a baby. But if it's normal, the chances are really high that it'll make a healthy baby.
So for the men or women watching from their desktops or from the Channel 3 Facebook page right now, what are if you had to give 2 or 3 major pieces of advice if they're looking to have a baby, what would they be?
Yeah. So the first one goes to your first question. Be as healthy as you can with, diet and exercise, and just be healthy. Avoid tobacco, avoid smoking, probably avoid marijuana too. That's a big hot topic now. So be healthy. 2 would be your fertility is best before the age of 35. And if you're thinking of having a bigger family, you may want to start earlier, or start thinking of ways to prepare yourself for that. The third, I don't know, I have to think about it.
And if someone's thinking, maybe, I don't know if I have a problem, should they just come see you?
Yeah, so the wonderful thing, so I'm relatively new to this center. I've been there for a year and a half, and it is such an amazing group of professionals. Our nurses are amazingly wonderful. Our docs are some of the warmest people I've ever met. It's a really good, friendly place, and we take pride in that. It's a great place to work. It's a great place to be a patient. Yeah, it is.
So for those of you just joining us, we're talking to Dr. Daniel Groh from the Center for Advanced Reproductive Services. New location.
Branford, Connecticut.
And they can always come see you in Farmington or Hartford as well.
They can.
All right. Well, thank you so much for joining us today.
Thank you for having me.
And thank you for watching.
Thanks. Is that it?
Hopefully. Very clear?
Well, I put bars up, so.
Okay, good.
Let me turn the microphone off, though.
Wow, thank you very much. You were very good.
Oh,
I mean, you were great.